the director for the Korea Health Policy Project at Harvard Medical School. You are now at the fourth and the last webinar in a series that we organized, really looking at health in the DPRK, their current situation, historical aspects, but really this particular one looks more in the forward. What does health engagement with DPRK look like post-pandemic, post-geopolitical realignment, current situation? And we're happy to have Frank. He'll get a proper introduction with my co-moderator. But I just wanted to let everyone know that these webinars are being recorded. There is a website where they'll be shared. These will be public, just so everybody knows. Please note that also, if you have questions, we'd love to get your questions. If you want to ask them in person, you're welcome to do that. Please indicate through raise your hand function or your chat function, and we'll elevate you to a speaker. Okay, so we'll move on. I'm delighted. So we have had a number of partners on this project, and one of them is National Committee on North Korea. Marissa McPherson is our co-moderator today. Hi, Marissa. She's a program officer at the National Committee on North Korea. She creates and manages NCNK's social media content, conduct research for NCNK initiatives, oversees member relations and outreach. She's also managing editor of all NCNK's publications. And in 2024, she was one of 4% of candidates selected as a Global Leadership Initiative Fellow with the Salzburg Global and Korea Foundation for Advanced Studies. She's also the Kim Koo Fellow. I can go on, but the best part is she is one of the key people within the National Committee on North Korea, which I'm a member. Really looking at engagement with DPRK as a way forward. So Marissa, welcome as my co-moderator. And today I'm delighted to introduce Samuel Han, who will be presenting. So this webinar series, we took the papers that we produce within our lab. Doesn't mean that we know everything, but we use it as a starting point for discussion because we had familiarity with that. Perhaps if we ever do this again, we'll try to enlarge the scope of papers that we will discuss. In fact, we probably will do that. But this was never, this particular series, we weren't trying to get a global perspective on papers that everyone has written. It was really a highlight of some of our works. And Sam, when he was at Yale, he contacted our lab, and he's been working with our Korea Health Policy Project as really a phenomenal research associate, co-authored a number of papers which he'll present today. Currently, he's actually in Kyrgyzstan at the University of Central Asia as a Canadian government-sponsored fellow. So Sam, over to you for your presentation.
Okay, thank you so much for that introduction. Good morning, everyone. I'm really honored to be here today to present on behalf of the Korea Health Policy Project. And as we already discussed, I can't believe it's already the final session of the webinar series. Hopefully today we'll be able to provide some forward-looking insights. So my presentation today is titled Prospects for Health Cooperation with the DPRK. And I'll first begin by outlining 5 broad health priority areas that reflect both the DPRK's stated health goals, areas, and where past collaboration has occurred. And the aim here is to provide a simple but useful framework so that if we were to come to the table to discuss health engagement, what are the areas that should be front and center? What's the most urgent? And what do we have the capacity to engage on together? And after that, I'll try to introduce the discussion on the how. I'll try and speak a little bit more about the mechanistic elements of health engagement, what's worked in the past, what hasn't, and how we could potentially get more creative. So to begin, it's really important to emphasize that health cooperation with North Korea is not a completely new concept. And over the past several decades, the DPRK has engaged consistently with international partners in the health space. And this has included direct collaboration with the Ministry of Public Health, coordination on joint initiatives and field programs. Strategic documents we have outlined here, such as the Medium-Term Strategic Plan, and also the WHO's Country Cooperation Strategy, has already gone through multiple versions in the last several decades, and these were all co-authored with the North Korean health officials themselves. And credit really should go where it's deserved. They really reflect a genuine willingness on the part of the DPRK to work towards improving the health of its population. In essence, North Korea has shown both an interest and also a strong track record of health cooperation when engagement is structured around mutual respect and clearly defined goals. So with that context in mind, I wanted to next draw on the health priority areas that we've identified collectively at the Korea Health Policy Project. And drawing on review from DPRK's strategic health plans, past efforts, as well as evolving global public health trends, we've identified these 5 areas, which can hopefully serve as a broad framework for future health cooperation. Now, this obviously isn't an exhaustive list, but these all reflect the longstanding need and emerging priorities, and hopefully practical entry points. So the first, we have renewed emphasis on communicable diseases, including tuberculosis, malaria, and COVID control would also fall under this bucket. Integrating technological advancements, maternal, newborn, and child health, addressing non-communicable diseases, and lastly, environmental determinants of health, understanding how other factors, climate risks, all of these come into play to affect health outcomes. So the first area I want to give an overview on is the renewed emphasis on communicable diseases. So historically, DPRK's medium-term strategic health priorities have shown a gradual shift away from communicable diseases. This is reflecting in part the global trend towards chronic and lifestyle conditions as the quality of life improves. But COVID-19 pandemic has obviously reversed this trajectory. And since we've already had some more in-depth conversations on the impact of pandemic, I'll try to not go into too much details, but in short, North Korea's pandemic response was largely opaque, and while it managed its pandemic, it also underscored a lot of urgent need for renewed investment, improved disease surveillance capacities, and outbreak preparedness. So looking ahead, infectious disease control is almost certain to return to the forefront of any discussion on health cooperation with DPRK. And we can also explore some specific examples in context with past collaborations in the next slide. So as I just mentioned, North Korea has a strong and often underappreciated record when it comes to collaborative infectious disease control efforts. And despite limited resources, DPRK has made most of what it has, leveraging both domestic capacity as well as international partnerships. And some interventions that were implemented primarily through the Ministry of Public Health, others executed more through effective collaboration with agencies. But to just highlight 2 really successful achievements, the 1997 Child Health Immunization Plan really had a successful outcome when it comes to polio efforts. And also the measles campaign in 2007 managed to reach over 16 million children in just 2 phases through very excellent operational measures. The next area we can talk about is integrating technological advancements. Now, it's critical for modernizing North Korea's health system on multiple fronts. DPRK has already shown increased interest in improving its medical technology, and in recent years, they've domestically produced CT scanners, artificial knee joints, and significantly ramped up imports of ventilators and pharmaceuticals. And this collaboration piece is really ripe here. Introduction of higher standard tools, practices, as well as operational care, a lot of the supply chain aspects, quality control, these are all really ripe for partnership when we're thinking about scalable and sensitive solutions within context. The other big piece here is also not just the equipment themselves, but the operational aspects. So in terms of critical opportunities to support the digitization of DPRK, there's electronic health records that could be improved, digital training, telemedicine, in order to improve also as it ties to the previous communicable diseases aspect, the epidemiological capacity overall at the intersection of these aspects. So we'll keep going. And the third broad category we have is maternal, newborn, and child health, often regarded as one of the most long-term strongest indicators of population health and health system performance. And in the case of North Korea, there has been very much measurable progress in the last 2 decades. From 2006 to 2015, the MNCH Strength Initiative was a $65 million program supported by the South Korean government, WHO, and UNICEF. And this multi-year project really expanded the health services across the country, from prenatal care to follow-up post-operation. And child malnutrition still persists in North Korea. According to the latest 2022 UN report, over 40% of the population faces undernourishment. And along with this, postnatal care, family planning services, all of these also tie into the broad population level concerns that the North Korean political leadership has expressed and poses internal incentives to be able to bolster this aspect of care in North Korea. And the second last, we have non-communicable diseases. NCDs are a growing area of concern in the DPRK, although historically they've received less emphasis on communicable diseases than communicable diseases. And as North Korea's health infrastructure improves, NCD prevention and control is becoming more urgent and visible. According to 2018 WHO's country profile, more than 80% of deaths in North Korea are accounted for by NCDs, and these include cardiovascular diseases, a lot of diabetes, chronic respiratory conditions that interplay with risk factors and behavioral aspects of health. Now, credit to North Korea. Just want to take a minute to explain the photo we have here. They've really done what they can domestically. They've developed its own nicotine patches, an example of what they're able to produce. And in terms of the public health campaign and risk reduction, they've also followed through with a lot of really wide coverage in its North Korean media. And beyond that, North Korea is also a signatory of the WHO Framework Convention on Tobacco Control, as well as a lot of other multilateral agreements. And as a whole, and on the global sense, it is a part of movements to be able to make an impact on the public health landscape. So last but not least, we have environmental health. Climate is not traditionally the first thing we think of when we talk about health cooperation. But in the context of DPRK, it is increasingly impossible to separate these determinants from public health outcomes. Now, in its national reports, international commitments, it's been made clear that North Korea views climate-related structural drivers as critical. And at the UNFCCC processes, the nationally determined contributions, North Korea has demonstrated its ability to follow through, make updates, and be a part of these global discussions, and does not shy away from recognizing the natural disasters and the implications it has on the health outcomes of its people. In 2020 alone, the country experienced 5 typhoons within a matter of weeks, and these environmental health risks represent a shared regional concern, which is so critical when we talk about health engagement and what that might look like in the future. Disease outbreaks, pollutions, extreme weather events, these don't just stop at the borders. And cooperation in this space could serve not just North Korea's population, but contribute to broader health security in Asia. I just wanted to bring this second table up as it offers a broader contextual reminder of the multilateral frameworks, the international agreements to which the DPRK has already signed off on, specifically in relation to health and environmental issues. And I think the key point here is that its efforts, it's really not an incidental one, but as long as its resources allows, as long as that North Korea feels that it's the right decision, it is able to and has continued to build on its track record of being a part of these conversations to do what is best for the health of its population. So this is the final slide that I have. And as I close, now hopefully we have a better sense of a framework to go off of when we talk about the health priority areas that is most up to date. And I'd like to start the discussion now about thinking about the mechanisms of engagement, the how when it comes to working with DPRK in health cooperation. And there are a few different ways to think about this. So first we have the bilateral engagement aspect. And obviously the first photo we have here is North Korea and Russia. And over the past few years, we've seen signs of deepening cooperation from medical personnel exchanges, training in specialties like oncology, cardiology, all the way to infrastructural support, including Russia's plans to assist with hospital construction in Pyongyang. And likewise, China has also been a part of this bilateral form of health engagement. They've played a longstanding role, including large-scale exports of ventilators, pharmaceuticals, especially since the pandemic era, with the customs data pointing to imports from China into DPRK reaching $45 million, which is nearly a tenfold increase from 2016. And then the second broad concept we can think about is the more traditional multilateral route. And this has shown both promises, but also experienced some setbacks. And historically, multilateral mechanisms have delivered measurable results, real results. And a great example is actually the Global Fund, which successfully supported programs tackling tuberculosis and beyond in North Korea. However, these programs have also shown how fragile it is, the trust that is built upon these engagements, such as in 2018, when the Global Fund suspended its program, likely due to external political pressure. This caused a significant disruption and, most importantly, damaged the trust between North Korea and the international. And North Korea has since not re-entered engagement negotiation to restart the partnership after it was cut off later on, most recently when it comes to TB efforts. And the idea of depoliticizing and assuring that depoliticization is critical. So that brings us to potentially what could be the third category in thinking about the how. How can we get more creative and think critically to move past these current obstacles and deficit in trust? And one model that we could consider is one such as the pandemic fund. Now, a multi-donor system that guarantees a politically neutral financing mechanism, such as the pandemic fund that's designed to support preparedness globally, is one that could be adapted for DPRK, one that ensures multi-year reliable support that is grounded upon humanitarian principles, neutrality, independence, and impartiality, and coordinated through a neutral international body like WHO or any other mechanisms could be one we could try and continue to build upon. And the goal here is not to just deliver aid, but to co-develop capacity to be able to provide a form of engagement that is insulated from politics. And instead of the stop and go that really has not worked, as we see, this model could provide a panel of engagement all the way from health engagement to potentially beyond. So I think I'll stop there for now. That's the end of my presentation. And if you're interested in some of the more deeper dive into these ideas, much of what I've covered today is contained in the article I've linked, a piece we co-authored in 38 North titled Prospects for Health Cooperation and DPRK's Changing Health Priorities. So please feel free to check that out. But yeah, thanks so much for letting me present and look forward to the discussion.
Thank you so much, Sam, for such an enlightening presentation. And now to pivot to the discussion portion of this webinar, it is my honor to introduce discussant Frank Aum. Frank was the senior expert on Northeast Asia at the U.S. Institute of Peace. He oversaw the Institute's work on Northeast Asia and focused on ways to strengthen diplomacy to reduce tensions and enhance peace and stability on the Korean Peninsula. From 2010 to 2017, he worked at the Department of Defense, including as special counsel to the Army General Council, special assistant to the Assistant Secretary of Defense for Asian and Pacific Security Affairs, and senior advisor on the Korean Peninsula in the Office of the Secretary of Defense. During this time, he advised 4 secretaries of defense on issues related to Northeast Asia and the Korean Peninsula. Also served as the head of delegation for working level negotiations with the Republic of Korea on U.S. ROK alliance matters and received the Secretary of Defense Medal for Outstanding Public Service. There are several more accolades under Frank's name that I wish I could get into more detail on. I invite you to go to his bio on ncnk.org. Yes, we are also honored to have him as an NCNK member. Frank, I would love to hear your comments. Please take it away.
Thank you very much, Marissa and Key and David, as well as Samuel for your excellent presentation. It's great to be here with such a fantastic group of experts and practitioners and just interested people in the audience. So I'll try to be quick because I want to get to the Q&A part. I always feel like that's the most interesting part of these sorts of panel discussions. But what I will discuss is more of the factors that may help us improve health cooperation with DPRK, particularly looking at what has happened in the past. And my assessment is based on the historical track record, health cooperation, but really most types of cooperation, particularly people-to-people engagement with the DPRK, is dependent on the geopolitical factors, particularly strong US DPRK relations, right? So we can go back to the 90s when, which I consider the golden era of US DPRK relations, starting with the bilateral agreement, the Geneva Agreed Framework, and then the US North Korea engagement that followed. That kickstarted a lot of people-to-people engagement. Of course, there are other factors. North Korea was undergoing a famine at the time, but in the mid-90s, that's when you had across the board strong US DPRK engagement and cooperation at the people-to-people level, but particularly on the health level. In 95, that's when the DPRK invited a number of NGOs, lots of US NGOs to come to North Korea, and they started these types of cooperation between North Korea and NGOs. That also extended to international multilateral assistance to North Korea, particularly the World Food Programs, massive package of food assistance, nutritional assistance to North Korea in the late 1990s. And then we see that cooperation, bilateral cooperation particularly, but also international cooperation continue through the 2000s during the Bush administration, and then including the Obama administration as well. But I feel like, if anything, cooperation has been more politicized over the years. And so, we had excellent cooperation in the 90s. It continued, even though there were more tense relations during the Bush administration. And then during the Obama administration, when there was no engagement, particularly during the second term, so 2012 to 2016, you still had ongoing people-to-people, track to different types of cooperation occurring, but that level of cooperation decreased, certainly in terms of, for example, the remains recovery operations, right, that happened between the Korean People's Army and the U.S. Department of Defense from 1996 to 2005. It was tried. There were efforts to resuscitate that in 2011, 2012, but that never happened. But you still had the NGOs that were able to operate in North Korea, as well as international organizations. A lot of that came to a halt or was significantly curbed starting in 2017 after the imposition of the U.S. travel ban after the tragedy of Otto Warmbier. And so that there was a lot more difficulty for the people-to-people engagement, the health cooperation, and then that was completely shut on the DPRK side with the advent of COVID, the COVID lockdown in January 2020, right? And that's basically where we are today, although there have been some inklings of abilities for outside organizations to get in, UNICEF and other multilateral organizations. But that's been the trajectory. And so, and even when you break down the different types of cooperation that occurred. And so I'm thinking of bilateral U.S. assistance, whether it's humanitarian assistance or other financial aid, NGOs, U.S. NGOs, international NGOs, international organizations, the UN, UNICEF, WHO, other organizations, or other bilateral international donors, China and others, right? A lot of this is dependent on U.S. DPRK engagement, right? Certainly not China, but in many ways, the U.S. influence, particularly on international organizations, is pretty significant. And I think that will continue to be the case going forward because of the politicization that we've been seeing since 2017. Now it's to the point where, we were always concerned about whether the U.S. was politicizing certain types of assistance, but the DPRK is almost a stronger factor here, right? If they're not interested in engaging, then they can shut down access completely. And we've seen that since 2020, and it continues to today. So I think, at least from my point of view, and we'll talk about other ways that we can shield off cooperation from some of the political factors. But I think at the moment, a lot is still dependent on improving U.S. DPRK relations, not only in terms of bilateral assistance and the ability of U.S. NGOs to go into North Korea, but also in terms of how the U.S. influences the international environment, particularly at the UN and other multilateral donor organizations. And so that really gets to the question of, is there going to be improvement in U.S. DPRK relations? And the answer there is unclear, but I think some helpful signals are, one, it appears that Trump wants to engage with the DPRK. He has messaged publicly. Anytime media ask him about North Korea over the last 6 months to a year, he has said that he gets along with Kim Jong-un. Getting along is a good thing. At a press conference with Prime Minister Ishiba about a month and a half ago, when the media asked him about North Korea, President Trump said, "We will have relations with North Korea." So I get the sense that, I don't know about the interagency or people in his administration, but I sense the president himself wants to engage and will make it easier to engage with North Korea. And I think because the president is the greatest determinant of U.S. foreign policy, that's a helpful sign, right? That being said, there have been no indications of a North Korea policy review. Typically, that's what happens in the beginning of an administration. They'll take a few months to conduct a review of various foreign policy objectives, including North Korea. The last two administrations completed their North Korea policy reviews in mid to late April. So the Trump administration, I think, the first one completed their review in mid-April. The Biden administration completed their review in late April. So that's the general time frame we're looking at. That being said, I haven't heard about an ongoing review at the moment, and I think there's certainly other factors in play, including the Russia-Ukraine conflict that will have a significant impact on our leverage, North Korea's leverage. So that in some ways needs to be resolved first, I think, before the U.S. can really engage in North Korea. I think also the South Korean elections may have a role. I know that there is some concerns that the Trump administration does not lend ear to its allies. That being said, I think it still wants to wait until there's some certainty about the leadership in South Korea, and that election won't take place until early June. And so it seems like if you're thinking about ripeness, right, for a U.S. policy to take shape, we're probably looking at the summer or later for the U.S. policy to really take shape. And then for the implementation of policy, probably won't be till later this year or even next year, right? Another factor to consider is how this administration feels about humanitarian assistance. We've seen steps that the Trump administration is taking to curtail and in many ways completely cut back on international humanitarian assistance. And so we know that it doesn't look at humanitarian assistance favorably, at least coming from the United States. But that's not to say that it wouldn't be okay with allowing the international community to provide necessary assistance as long as the U.S. doesn't take the lead role or in ways that it feels is excessive, right? So that's another factor to consider as well. I think, you know, we could potentially have a situation where the U.S. administration reaches some sort of deal with North Korea that allows for more engagement, that reduces obstacles and hurdles, say on the sanction side, which then allows for more humanitarian assistance and health cooperation to continue. But most importantly, when you have improved US DPRK bilateral relations, that also allows North Korea to then feel comfortable in providing greater access, especially to US NGOs, right? So that's the real key. North Korea needs to provide the access because it seems like the US has slowly been relieving some of the obstacles for that assistance. I think the best signal would be a lifting of the travel ban, but also allowing for exemptions or sanctions relief that help on the banking side that would facilitate humanitarian and health cooperation. But these are the factors I think are most important. So I think where I come down on the role of humanitarian cooperation is I think it follows rather than catalyzing US DPRK, the improvement in relations, right? So I'll stop there, and then hopefully we'll have some good discussion.
Yeah, thanks, Frank. You steered the conversation exactly in the direction that we wanted you to, because we wanted to move a little bit away from the technical discussion around health and to more the political space, and you really hit a lot of key points. I'm gonna go to Margareta Wallström now. She's joining us. She's a Swedish diplomat. She worked at the UN, and in fact, she was the UN Assistant Secretary General for Disaster Risk Reduction for a number of years, and now she heads up the Swedish Red Cross. And some of you know that the Swedish Red Cross actually does a lot of programming inside DPRK. And Sweden is one of the few countries that have actually reestablished their presence, diplomatic presence in Pyongyang. So, Margareta, please, you feel free to comment on what Sam's. By the way, Sam's, your talk was excellent, but also what Frank has discussed.
Yeah, thank you so much, Kipak. That was very interesting. I came a bit late. I apologize, but I think I heard most of the points here. So let me pick up where Frank just dropped off now by saying that humanitarian assistance is rather likely to follow rather than to catalyze engagement. And I'd say that I've been involved since 1995 in the first time that humanitarians were invited to assist in the then crisis. And over the decades, it's been ups and downs in relationship, very much related to external political events, changes in attitudes, but there have also been, up until the pandemic, actually, it's been rather consistent that the cooperation has functioned one way or the other. In what we call humanitarian, which is very much, I would say, an externally defined way of cooperation, and but also with long-term implementation and engagement by, as we talked about, health cooperation in other areas. So, you know, agriculture, health and forestry, small industry, there have been many areas that actually worked over the decades. So in the case of Sweden, we have multiple agencies and organizations that have been involved, universities and others. So there's ample experience. And I would say in Sweden particularly, it's been a very consistent policy by the government, the foreign policy, but also we together have kept contacts with each other, exchange experience. But on the humanitarian, I will say what I've said many times over many years. the DPRK government, like most governments in the world, they don't want to be seen to be recipients of humanitarian assistance, particularly not long term. In an acute crisis, yes, but not really seen as a country that needs humanitarian aid. On the contrary, and that has been the request and the definition. And if the UN or the Red Cross has been in a slight crisis of cooperation with DPRK, it has several times been around how we define the nature of the cooperation. Their view is, yes, we want to have development cooperation. We need your support in long-term investment to strengthen our country. We don't want humanitarian support. And I think the COVID shutdown, so to say, it went on for a few years. Eventually we were able to pick up on shipment, sending goods, but we couldn't send in people. And that has become, of course, an issue for both the UN and Red Cross if you cannot follow the goods to the end user. And this has now been going on for so long, so I think we have to conclude that this is now really consistent policy by the DPRK authorities, that they will be extremely rational in who they invite to come back to the country. So political contacts, countries that they benefit from cooperation with. They tried to set up a trade exhibition, but they didn't get many probably of the participants they wanted. China apparently hardly showed up. So the current relations between them and Russia, I think in a way is an impediment to opening up even a bit more to other arenas. So I don't see that the humanitarian assistance as humanitarian will pick up, maybe never again, unless there is a major humanitarian crisis. The opportunity that we need to look for is practical cooperation in areas that they really value. Health is one, development, agriculture and sustainability, the capacity to respond to disasters and handle them well. Which we see that they are seemingly projecting that they have a much better capacity now, and they certainly do as compared to 20 years ago. So that's just some of my reflections on what you've said. But really my question is also to Frank and others. I think there is a willingness, I know there is a willingness and engagement from many of us, but we need someone to talk to. And right now, we don't have anyone to talk to. It's very hard to find a connection. But one of those that we do have, they are members of the governing board of WHO for another year, maybe. And that's my question. Is this an avenue for a conversation with slightly broader angles? I don't know. There are others who have connections, very informal, and trying to support with technical discussions on issues that pertain to vaccines, sometimes to agriculture issues. But it sort of ends there. It doesn't develop into anything where we can actually make use of both the willingness and the maybe resources. And I have a question to you, Frank, that you actually expressed that Trump, as the symbol of the US government right now, wish to have relations with them, even if it will take time. But I also understand that complete shutting down of the funding, all the financing of anything having to do with DPRK has gone down right now. But maybe the left hand doesn't know what the right hand is doing on this issue. So that's just a question for me. Thank you.
Thank you so much, Margareta. And Frank, I also have a question for you, so perhaps we can address these in tandem. I'd like to dive deeper into something that Sam brought up during his presentation, which is the environmental determinants to health. Given that the North has historically engaged with the international community on these issues, is there potential for climate and environmental issues serving as a point of entry for broader health engagement? Frank, I'd love to get your thoughts on that.
Sure. So maybe I can address Margarita's and your question directly. So Margarita, you posed a question to everyone. I wasn't sure I understood because you said, who do we talk to? Are you talking about who do we talk to in the U.S. administration, or I'm sorry.
In DPRK.
Okay. Yeah. Well, so at this point, yeah, we're very limited on who we can talk to at DPRK, but I would think that the DPRK mission to the UN, as well as other DPRK access points internationally, so whether that is in missions in Europe or Southeast Asia or elsewhere where they are engaging, that would be the best bet. But I think certainly for international organizations, the DPRK mission at the UN would be the best chance of trying to engage on some of these issues. I haven't heard of any shutdown in US funding related to North Korea. What I have heard again is the significant deprioritization of US interest and funding on humanitarian assistance, development assistance in general, right? And so North Korea could be wrapped up in that. But that's not to say that the U.S. is not interested in improving relations with the DPRK writ large, right? And so I think that's one area where a broader campaign to enhance health cooperation could focus on, right? What do we do in a situation where it looks like the U.S. administration wants to improve relations, but they don't really want any part of taking the lead on providing financial assistance related to these fields, right? And I think some of the things that Key and David and Samuel have mentioned probably provide an excellent starting point, which is depoliticizing, right? Having a multi-donor fund or group that will reduce the burden on the U.S. while facilitating relations and engagement with North Korea. So that I think you could present as a win-win to the US, right? Hey, we can do this. It's not going to require the US to take the lead. In fact, we're going to ask the international community and NGOs to take the lead. So it helps everyone, right? I think that's probably a better way to pitch it. The question now is how do we access the US, right? Who are the players? Who can we talk to? And I think one of the questions in the chat box kind of hints at this, right? Who are our ins, right? Who are the people that can talk to Trump directly? Or how do we influence Trump? You know, we've heard a lot about how he watches, you know, Fox News and other stations, and, you know, he'll interact directly that way, maybe even on social media. So those are some of the other strategies to consider. Who are the influencers that can accelerate what the U.S. is doing on North Korea? I'm sorry. I'm sorry. One last thing is the environmental. So I think on your question, I think there's a lot of crossover and synergy in terms of climate cooperation and health cooperation. And to the extent that we can work with North Korea on climate and that extends to health, that's great. But like I said, I think not just health, but many forms of cooperation depend on an improved geopolitical environment. Unfortunately, that's what I've seen over the last 25, 30 years.
Well, thanks, Frank, for those comments. I agree with you in almost on every point. I'm gonna come to Professor Joseph Yi. Are you able to unmic? He had put some questions on the chat, and I thought he could ask directly. Professor Yi, can you introduce yourself and ask your question specifically to somebody. It's better than an open-ended question. So if you can address it to somebody, and maybe you can say a little bit about South Korean politics, and this it relates to North Korea. Over.
Okay, sure. Hello, my name is Joseph Lee. I'm a professor of political science at Hanyang University in Seoul, Korea. I do transnational and international politics. I had two questions and a brief comment. Question one was, I was wondering how the Trump administration budget cuts has impacted NGOs such as yourself. And also, for example, Trump is threatening a lot of cuts at Harvard. How does that impact, how does it impact your work at Harvard? Number two, this is, do the speakers or audience members, do you have any personal connections to the Trump administration, either direct or indirect? For example, I know like Franklin Graham, Samaritan's Purse, he used to be very connected with the Trump administration. Is he somebody that we can work with to maybe influence North Korea policy? And then my brief comment was that along with US policy, we should also think about how can we dialogue with the governments in South Korea and Japan. So for example, I've been writing for like Japan Forward, which is the English version of Sankei newspaper, which is connected to the LDP government. So I think it's very important to connect, to get other governments involved as well, and to share, our knowledge and our experiences with North Korea. And also your question about what was your question about South Korean politics again? Do you have a specific question? What's going on?
Well, do you have any sort of assessment on where it's headed, and in terms of North Korea policy with the new snap election?
Right now it's kind of up in the air, and so the betting market is that Lee Jae-myung is going to win. He's from the Democratic Party, and so if that happens, you might get a big shift in policy. So Lee Jae-myung tends to be more like pro-North Korea reconciliation, more maybe more hostile to Japan. But I think the problem with Korean politics is that depending on the party in power, we get these huge shifts. And I think that, in terms of North Korea policy, we want more stability. And so it doesn't really help North Korea if if let's say we're pro North Korea like Moon Jae-in, but he never talks to like Shinzo Abe, so he visited like Kim Jong-un like 2 or 3 times. He hugged Kim Jong-un, but he never talked to Shinzo Abe, right? And so I think, if you really want to engage North Korea, you need to form a consensus with South Korea, Japan, and the United States that we want to sustain this engagement, that we don't want to demonize anybody. But unfortunately, Korean politics is about which country is worse, North Korea or Japan. And I think that's very corrosive to sustain engagement and reconciliation.
Great, thank you. So I think one first question was directed at me. We do not receive any federal funding in terms of North Korea work. So
okay,
there's your answer. But the second part was the U.S. NGOs, and Keith left a very good remark on the chat, which is most U.S. NGOs, including Samaritan's Purse, are privately funded through donations, so they're not affected by funding cuts. But the problem is, I think Frank talked about this. None of the U.S. NGOs have been invited back, right? So this is the issue. The DPRK side has not opened their door yet. So. I think Frank, you have your hand up. I'll come to you,
Yeah.
and then Marissa, you're next.
I just want to follow up on Professor Yi's statements. So, if you could recall back in 2018, when President Trump agreed to meet with Kim Jong-un. I mean, prior to that, no one was meeting with Kim Jong-un, right? And then when President Trump decided to meet, then that unlocked and caused this sort of like this rush for everyone to meet. And then you had Xi Jinping wanting to meet. Certainly Moon Jae-in was already very aggressive about engaging, Putin as well. And so at that point, Japan was on the outside looking in, right? And there was concerns about Japan passing. Japan was the one, Abe was the one who wanted to meet, and he couldn't. And so he felt like President Trump had to carry Prime Minister Abe's water in terms of pushing on the abductee issue, right? So you could create that sort of similar situation once President Trump decides to engage again. The difference today and I think it's an important factor for South Korea and whoever the next president is to consider, is that Korea does not want to be passed over. They also want to be at the table rather than having Trump negotiate their interests, right? And so if it's a conservative president, then they'll need to think about how they change their policy. If it's someone like Lee Jae-myung, even then, I think either party that's in power needs to look at the South Korean unification approach, right? Because that has changed. For the long-standing approach was, this, three-phase system that eventually gets to unification. But earlier, recently, North Korea changed their policy so that they no longer consider South Korea as a part of their system, and they consider South Korea separate and their principal enemy, right? And then last year in August, President Yoon created a new policy that's a very aggressive, almost a regime change policy that gets towards reunification, right? But because he was quickly impeached, and that impeachment was now confirmed, it's unclear what South Korea's unification policy is, right? And so I think the new president needs to confirm and clarify what that approach is. If it goes back to the original approach, North Korea may not be happy because, again, they consider South Korea separate. If South Korea develops a new policy that basically is not a unification policy, but rather a normalization policy, meaning normalizing relations with a separate North Korea, then you may have the opportunity for increased inter-Korean relations, and that may lead to different types of health cooperation on that front.
Thank you so much for that, Frank. I'd like to pivot briefly back to some of the on-the-ground realities that, were maybe historically present or that we can expect. I'd like to leave this question open for both you, Frank, and to Margareta. As you both are aware, there are numerous challenges related to the provision of healthcare inside North Korea, and given your understanding of the situation and acknowledging that there is a range of deficiencies in the healthcare system, what do you view as the segment of the population that's at greatest risk? And for people within that category, what do you view as the primary challenges? Whoever would like to take the question first.
Sorry, I didn't quite pick up that. There are certain parts of the population that get priority, particularly now. Urban people are doing better than the rural, but most of us who have worked in the country over the years, our experience is that the overall health situation has improved over these 30 years, of course. For many reasons, of course, we have contributed to it, but there are many other reasons too. Having said that, there are still, in particular, rural areas, and particularly in the parts of the country that, in a way, are most difficult to reach, that have the least, I would say, possibility for agricultural development. It's a very mountainous country. It has an underdeveloped agricultural potential. There is an ongoing issue about clean water, which contributes to bad health or good health, depending on. And the long-term nutritional support that has been provided by colleagues in UNICEF and others, of course, has been interrupted. So there is no doubt that there are questions around the sustained public health among certain parts of the population, which is not primarily the urban, it's the rural parts of the country that would suffer. And with the regular impact of cyclones and droughts, the uncertainty of the sustainability of even short-term improvements must always be questioned. So I think that's the general picture. But having said that, we don't have very updated good information. So first, that's the family dog who is engaged. And we always try to understand more about the situation. Thank you.
Great. Hazel, can I come to you? You put a very provocative, comment on the side. What is US's role? So maybe you can ask that question directly. And yeah, Hazel, can you introduce yourself as well?
Yeah, my name's Hazel Smith. I'm an academic who's worked on North Korea for about 30 odd years, and I've lived and worked for the UN also for a few years in DPRK. And my question is, and it's related to what Frank said, which is about as I understand it, about the predominance of geopolitical relations. And although he mainly was looking at US policies, I do think that the geopolitics of what, as everywhere, of course, but particularly in relationship to North Korea, the geopolitical framework is going to frame what can be done, especially by US NGOs, but also by others in the broader development and humanitarian community. But where I differ with Frank is that I think that from what we've seen in this first year of this new US administration, what we know is there's no certainty and that there is no stability. And that means that, and also we have a completely different geopolitical framework now, where it looks like China and the Europeans are going to be working together on trade issues because of tariffs. Not just the Europeans, but Southeast Asia, the rich countries of the BRICS, the so-called BRICS, and everything else. So we don't. It's not like in the Clinton years or when, as Margarita pointed out, we saw quite a lot of flourishing of DPRK US influence, which is framing everything that's going on. I don't think that's the case at all now. And that means in terms of US relationships and what US NGOs can do with DPRK, there's going to be two things. One is the facilitating environment, and the other is the active environment. The facilitating environment, given that the US, that Trump still sees himself as at some point facilitating some relationship, having some relationship with North Korea, perhaps if Russia and Gaza don't give him the Nobel Prize, I'm sure he's convinced that North Korea might do that. And that I'm not being facetious at all. I mean, he's more or less said that. So that means in the broadest scheme of things, in terms of, and again, going back to the subject of this talk, which is about North Korea's medical needs, medical and health needs, is there going to be a situation where the Trump administration would facilitate, say, UNICEF getting involved or WHO getting involved in North Korea and facilitating the flow of goods like immunizations and all the rest of it? And I think that might be possible. And it looks like, because quite a number of the Europeans are back in DPRK now, the Bulgarians are back in the EU as well as the Swedes, and there are others negotiating and probably will be back in soon, including maybe even the Germans. So I think that given that UNICEF is obviously geared for children, but given in North Korea's, if you look at all the health documentation that's come out of North Korea over the past 30 years, some of the most sophisticated and the best and the most comprehensive quantitative and qualitative analysis has come from UNICEF with its data on child malnutrition. If anybody interested in looking at the 2017 national surveys and all the various analyses that were produced from that, I think that's still some of the best data we've ever seen on North Korea. WHO does it, of course, but UNICEF. So there's a possibility there might be a facilitating environment for UNICEF, and in that case, there may be a possibility for the US to get engaged through continuing to support UNICEF. Of course, it's come out of WHO, so that's not going to happen, but it might be through UNICEF. So that's what I talk about, the facilitating environment. In terms of the possibility, this is Harvard, this is a US environment. I mean, Harvard's got its own problems with the US administration at the moment, plus the things that we don't need to rehearse about various think tanks that are involved, that would be involved in international issues, and therefore North Korea. So therefore, the question then is there going to be a political environment in which the US, this US administration will be more directly involved in North Korea? And I think that's highly unpredictable, highly unpredictable. If that were the case, then it could be, given this, the way that this administration has run, that sanctions just could be lifted. So with some form of Singapore type agreement, which was actually signed, and then an instruction to the State Department, which is Kevin Kim, I think, that's leading the in a very, very wide sphere of interests, leading what's happening on Korea inside the State Department. So but that's not, you know, something that anybody can rely on from the US.
Hey, Hazel, we're at the hour, so
Stop.
what I'm learning is that we should definitely have a more in-depth discussion around this topic. There's a lot to be asked and discussed. We will do that. We will, but that's my personal promise. But we're at a point where we have to close down the Zoom meeting. I just want to give Margareta, Sam, Frank, and Marisa one sentence. One sentence. What should we take home from this meeting? Go ahead.
So, Key, can I say, I think just like Hazel also expressed, even though in the bigger frame, it would be valuable if US did a policy review and demonstrated impact, but I think there are also other avenues. And you mentioned Sweden is back in Pyongyang, and there are other governments that are as well. So if they are willing, we could achieve more, but the geopolitical framework within which we operate is completely different from when we did that last time.
Okay.
And therefore, I think still there is a need for, if not cooperation, but an attitude, an expression of an attitude from the US. It's more than one sentence, but an expression of an attitude that says what others are doing is helpful.
Okay, I like that. Frank.
Yeah, not necessarily a takeaway from this discussion, but what I think is a takeaway from my assessment of the situation is that I think, again, the greatest determinant of cooperation, lower hostility, improved security with the DPRK is improved relations and trust with the DPRK. So whether you want to increase health cooperation, remains recovery, political issues, military, reduce North Korean provocations, increase human rights cooperation, any of these things, you need to have trust and improve relations with North Korea. That is a fact. It doesn't mean that improved trust makes DPRK an ideal international partner, but you must have improved relations to improve DPRK behavior.
Love it. Love it. Sam?
Yeah, my 2 cents takeaway here would be, I think there are a lot of interesting conversations on the political aspect of when this relation might get better. But when that time comes, when the political will from the top manifests and there is an opportunity to come to the table, taking on the public health and health lens, is we should be ready and be well prepared to know what are the mutual interests, and make sure we can capture that opportunity.
Excellent. And Marisa, you have the final word.
Thank you, Key. I say this as someone who tends to be a bit of an optimist, even after working on North Korea for 3 years. But my main takeaway from both this session and the series as a whole has been inspiration of not only the wonderful hosts and co-hosts of this webinar series, but also the active audience engagement. It's clear how much care and passion there is on this issue, and that makes me feel a lot more inspired and confident that we will get somewhere on this, as long as this dedicated group of people continues to work on it.
I love it. We end on a message of hope. I just want to say thank.
Is it possible I've written a question. Is it possible for me to just say one sentence?
Sure, Roberta, please.
Thank you, because I feel I've been ignored. What I come away with is that there's great eagerness to restart some kind of better DPRK-US relations, and also that includes providing assistance if that's possible in however formulation North Korea would like it. But my fear is that there's not sufficient attention to what you would like North Korea to be doing in this relationship, and that the community, the international community, if they get more engaged, will not stick to their own standards on monitoring and on access and on the many other things that have worked out badly over the years. and the distribution of aid in North Korea. And I think it would be a good idea to also know what you expect of the North Korean side, not just the American side.
Excellent comment, Roberta. So message of hope, but with caution and do it responsibly. I completely concur with that. I just want to say thank you to all the panelists and all the participants over the last 4 webinars. Our partners, National Committee on North Korea, USIP was the partner at the beginning. Now it's gone, but still, Frank, thank you for being a partner in this. 38 North has been an amazing partner. Jenny, I know you're on this call, and then Children of Korea. So thank you, everyone. The recordings will be available. We'll share the link to that website. Thank you. Have a great day.